Bells went off, the whistles are blowing, and it is a happy new year. We're a day off. Today is January the 2nd. Normally, we would be bringing you the Healthy Flint Research Coordinating Center's community webinar on coronavirus on Friday. But we knew all of you would be enjoying your families on New Year's Day. And so we thank you for joining us today, January 2nd, for the community webinar on coronavirus. This is week 41. Am I correct, Dr. Deborah, or is this week 42?
Week 41.
Week 41. 41 weeks now. Many of you have joined us, and we're thankful that you've joined us again today for this very important conversation. On behalf of the Healthy Flint Research Coordinating Center, which is a community and academic partnership, we are bringing to you information as much as we can learn it on a regular basis about coronavirus and what's happening in our community. So today, we're going to be talking about vaccine part 2. I am so excited to be your moderator today for these 41 weeks, and we look forward to being engaged in the conversation. For these weeks, we've had this wonderful partnership, it says 42, correctly, partnerships from organizations and agencies across the city of Flint, Genesee County, including the state of Michigan. We have represented from the governor's office as well as the Department of Health and Human Services. This has been just a tremendous effort collectively to bring quality information to you. If you're listening to us today and you want to put some information into, as we're streaming live, you've got some questions that you want to share with us, or even you may want to call our number at 835-2130. Give us a call, 810-835-2130, and we'll still try to answer those questions. Or you can go to the HFRCC website and put some information or questions in there. We'll be happy to answer them for you. Today, as you can see, we have a very exciting panel. Today, we have with us, along with my real partner who's behind the scenes orchestrating for us, Dr. Deborah Johnson. Thank you. She is the co-director of the Healthy Flint Research Coordinating Center representing Michigan State University. We also have with us Suzanne Kupel from the Genesee County Health Department, the Public Health Division. She has been one of our partners from the very beginning. Today we have a new guest with us, Dr. Jennifer Edwards Johnson, who is also with Michigan State University, and she's got a whole lot of other titles we'll bring forward in a moment. And then anchoring us all here today is Dr. Lawrence Reynolds, who is the Chief Health Advisor for the City of Flint. So I want to say good morning, good afternoon, and Happy New Year. Let's talk about, we made it. It's 2021. Suzanne, you've been telling me over 2 weeks. I can't wait.
I can't wait, and I'm so glad that we've put 2020 behind us. We look forward to 2021 being a better year. We recognize that we have vaccine now, and the challenge will be getting the vaccine into our community.
All right. So I want to jump. Dr. Reynolds, you've been here most of the 42 weeks that we've been here. What do you say? It's 2021. Did you think we'd be here?
Oh, yes. I had faith and I had hope. And it gives us an opportunity to correct some of the errors that we made in 2020 and improve quality and refocus our plans.
So I'm gonna restate that question. I wondered if you knew we'd be here on the webinar talking about this.
Well, I know you, Yvonne, so yes, I knew we'd be here.
Well, Dr. Johnson, this is your first time joining us. What say you? 2020 is beautiful star side.
I'm just thankful that we have gotten to this place where we are, where we've gotten a vaccine, and I'm really kind of looking forward to the opportunity to be a part of disseminating the vaccine and making sure it gets to our communities who need it.
All right. So, Dr. Johnson, come on now. We've been talking about this for a long time, and you made this really happen for us for this Saturday event. So 2021, here we are.
I know. I'm happy 2020 is over, and I'm just standing that 2020 be the fulfillment of all of the possibility that we didn't see realized in 2020. But I will say I feel really good about the conversations that I've been in and the things that I've heard. I'm watching people. I myself have moved along a continuum as I think about and make decisions for myself and my family about the vaccine. And a big part of that was because I was able to get information, get my questions answered, weigh it out. Lord, come in here. So many people. I'm not even kidding you. I can name probably 7 or 8 people off the top of my head in my close circle who are either active COVID cases or recently recovered. And none of them were asymptomatic carriers. None of them were in this group of people who just sort of got it and seemed to just it be no big deal. So, I'm really excited about where we are, and I think 2021 holds a lot of promise. And I'm super grateful to have another epidemiologist on from the health department, and then to have 2 physicians, a pediatrician and a family physician, who can really help us make sense of it all. This is like the dream team here, and then our community leaders. So let's get it.
Yeah, so I was thinking yesterday. I just spent my bubble was really small. My three, which is me and my 2 daughters, my sister, her daughter, and her grandson. That's our little bubble. Been tested, everybody's negative, and even sitting last night as we're talking, in my mind, I couldn't help but think, we're hoping everything is okay, and we're talking, and it's like. You in the back of your mind, is everybody really still okay? Because Dr. Deborah, you mentioned asymptomatic, and I just want to spend a few minutes talking about this because it still is an issue for people when they say, I feel fine, but does that mean anything?
Well, Dr. Reynolds can probably answer this one, or Dr. Johnson as well, if not better than me, because there's both the asymptomatic and the presymptomatic. There are the people, and then I think there's also something maybe a little bit in between. And I always point to D.L. Hughley, who's a pretty prominent comedian, who described himself as asymptomatic, except he fainted on stage. Yeah. He attributed his exhaustion, the fatigue, the aches to being on tour. So it wasn't that he was without symptoms, asymptomatic. It was that he didn't recognize the symptoms that he was having as symptoms of COVID. And so, I just tell people the only thing you can really do is do everything you can to keep yourself safe and to honor the protocols. If you are going out, or if you're letting people come in, because that's what also happened over the holiday. It wasn't just that people went out, people let people in. You just have to get tested. And if you want to be responsible, if you've gone out or let people in, you need to be in quarantine and get tested, and that's the only way I think that we can ensure, because there will be people for whom they will get this virus. And I know it. I have family members this happened to. My youngest cousin, but my cousin's son, but his father got it, and he was down for 3 weeks and ended up hospitalized. It was a very different experience. And I'm assuming they had the same exposure, so they've got the same sort of strain, if you will. We've talked a little bit about that, of the virus, but how the dad responded and how the 16-year-old athlete responded were very, very, very different. So I don't want people to think just because you don't have symptoms that you aren't able to, 1, spread it and put others in harm's way. And then 2, we've got cases now of people who have become recurrent cases who had very few symptoms the first time and then got whomped over the head the second time. Oh, wow. So that might be a good segue too, because I know people keep asking the question, if I've already had it, do I need to get vaccinated? So I'm gonna stop and hand it over back to you and then to the others.
Yeah. So just quickly, Dr. Deborah, when you talk about that, personal responsibility is something we talk about. And Dr. Reynolds, last Saturday, you shared with us something about the Swiss cheese. It was so good. I want you, if you would, just let's spend a couple minutes talking about that again, because as much as we're protected, I kept looking at my little, I call him my little grandnephew, and I'm thinking, God, I continue to think we're all okay. But what are those layers that we need to think about?
Oh, yes. Well, have you got the diagram that you can pull up? There's at least 10 layers of protection, and think of it like 10 slices of Swiss cheese. And the holes in Swiss cheese are never uniform. They never go all the way through. So each slice provides some protection. And I wish I had come up with this because it's brilliant. And it talks about, let's talk about the dark yellow brand, personal responsibilities. And you see what they are. If you feel sick, stay home, maintain physical distance, wear your mask is the next layer. Hand hygiene, that's washing your hands for 20 minutes in warm soapy water, or if that's not available, using a sanitizer that's greater than 62% alcohol. The next layer is avoid touching your face, and that's my big challenge because I'm always adjusting my glasses. The next layer of personal responsibility is, if you are in a crowded situation, limit your time. Or like they used to say in the Cupid Hustle, was that it? Back up and walk out the door. You don't have to stay there. Then the next layers are shared responsibilities. And that is, we need fast and sensitive testing and contact tracing. Okay. Also, when we go into a building, be it a school, a church, outdoors, an office building, we need ventilation, and the system needs to have been changed. The filters need to have been changed. There should be airflow. The vents should not be blocked, or ideally you're outside with fewer than 250 people and you're maintaining social distance. Then the next layer, and this is the most important at this time, and that is messaging from our government and financial support. So people get the truth, the facts, and they get the information on which they can act, and then financial support to maintain the storage, distribution, and administration of this vaccine and other information. Then we need to maintain quarantine and isolation. So if you get that call or you see that message on your app that you've been in contact with someone who has COVID, you go into isolation, and around the 5th day, get tested. Okay. And then there's isolation. If you are positive or if you have symptoms and you don't know yet, put on your mask and isolate yourself. And then lastly, and I'm not saying least important, I'm saying all this is integrated, there's vaccines. And at this point, we have no treatment for COVID-19 disease. So vaccines are essential. And I'll turn it over to my adult colleague.
That's critical. And while you're there, Dr. Johnson, you shared with us that you got the vaccine. The vaccines. Can you? And I want to mention too that Suzanne Kupel also received the vaccine. So we have two perspectives that we want to hear. So tell us about your experience and what more we need to know about vaccines.
I really appreciate that approach that Dr. Reynolds mentioned, because I think it highlights the idea that even once you are vaccinated, there are still all of these practices that we have to keep up with and that we have to make sure we're doing. I got the vaccine about a week and a half ago now, and my experience was seamless. A little pain as I got the vaccine with the needle, but nothing too concerning. I actually didn't even have much arm pain. But right after I got the vaccine, I was kind of moving that arm around because I know that can be a side effect. I had no kind of symptoms or anything after the vaccine. For me, as a family physician, I'm seeing patients in the office, and I'm also a part of our residency program. So I round in the hospital with our residents. And for me, getting the vaccine was it was a breath of fresh air. It gave me a little bit of a sense of peace, knowing that I was halfway to the point of being slightly, adding protection against this virus that we see. And I want to highlight what you mentioned about asymptomatic versus symptomatic patients. There is this idea we have people who have COVID-19 who carry no symptoms throughout their entire sort of disease course. And then we have people with COVID who are pre-symptomatic, like Dr. Verholden mentioned, where they just may not have developed symptoms yet. And so that is why when you think about all of those layers that Dr. Reynolds mentioned, it becomes so important to distance, to wash our hands, to make sure we're wearing a mask in every setting, and to be thoughtful about our exposures and who we're going to be around. because we really just don't know at this point who's pre-symptomatic, who's asymptomatic, and we're really doing our best to kind of work with each other and kind of meet that community need.
Yeah, there's so many unknowns, as you mentioned, Dr. Johnson. So we want to, as we're walking through this, and for those of you who just may have tuned in, you're with the Healthy Flint Research Coordinating Center's our community webinar on coronavirus. So we do thank you for joining us today. And so we have Dr. Johnson's perspective, but I want to put this little pin in because we want to talk about the many things that we don't know while we're working on the things that we do know. Suzanne Cooper also had vaccine in the last week or so. So Suzanne, can you talk to us about your experience? Was it any different from what Dr. Johnson shared?
So Wednesday, I got my immunization at 1:23 in the afternoon. I did have arm pain, so I was moving my arm around. I was, trying to do all the things that I know that are needed, but I still did have a very sore arm for 2 days. And today, I'm fine. I don't have any arm pain. I'm doing well. I did sign up for the VSafe app from the CDC. So for those of you who don't know, that's an app that you'll be informed about when you do get your vaccine. And every day you check in with the CDC and they ask you questions about how you're feeling, whether or not you have any signs or symptoms or any specific complications related to COVID-19 vaccination. And they're keeping track in real time of who has a reaction, who does not. And that information will help us a lot as well. We also have to recognize that once you get immunized, it does take your body time to be able to produce some protection against COVID-19. So we're talking about 14 days after you get immunized to start to see some of those protections. So this is the first dose. The next dose will be 25 days from now for me, and we'll see what happens with the second dose. We're hearing that sometimes people have a more pronounced reaction to the vaccination after the second round. So I'm looking forward to being able to come back to you and tell you what my experience is after that second dose. But I do want to remind everyone, too, that there is a protocol for how we vaccinate everyone in our community. And there's a lot of questions being asked right now about when can I get vaccinated? And one of our challenges, even as a health department staff, is that we don't know when we're going to get vaccine again, how much we're going to get, but we do know the order or the priority guidance on who's going to get it next. And so I'm going to remind you about our website, www.gchd.us. If you click on the COVID-19 button, it will take you to a page. And then the second category on the right-hand side is vaccination information. You can click on that, look at the guidance document, and it will walk you through who the priorities are for vaccination and how that pathway is going to move forward. And we will keep you informed every step of the way as we can get people vaccinated.
Thank you, Suzanne. I was chuckling here because when you mentioned it, you said the time, the day, the time, and even the minutes. I was out, and Dr. Reynolds, you can probably relate to this, a song we sang in church sometime. I remember the day, I remember the hour. So that's how this impacting this is. The day.
It is very impactful. And I've got to say, Yvonne, I can tell you it was 1:38 when I had my 15 minutes of waiting to make sure I had no reaction to the vaccine. Those are other things that we want to remind everybody about, that once you've gotten your vaccination, you're going to want to hang around 15 to 30 minutes just to be sure that you don't have an allergic reaction.
So Dr. Johnson, I saw you. You gave it the thumbs up there. So what other things come to mind as you listen to her? Did you have that same kind of thing? This date and time is ingrained now in your memory.
Absolutely. I don't know that I am as specific as our colleague, Dr. Kupel, but I had a 4:00 appointment, and there was a line of about 25 people, and we moved through that line really quickly. It took maybe 15 minutes, and we also had the protocol of waiting 15 minutes after to make sure that you didn't have any allergic reaction. But I do remember having this kind of sense of excitement. I definitely had this sense of there was a little bit of nervousness, right? Which I think is reasonable. It's a new vaccine. You are doing a new thing. And so there was definitely a little bit of that nervousness. But what I was excited about was this idea that I have watched for almost the better part of a year patients come in and out of the hospital with COVID, and I've seen those side effects. And I know what the ramifications of COVID look like. And so I felt really comfortable and really kind of thankful for the opportunity to be one of those to get the vaccine, and hopefully get some protection against this virus that we've been working to treat.
Yeah, so thank you both for sharing your experience. I want to talk with you a minute, Dr. Deborah, before we go to Dr. Reynolds on something. But we've kind of been vacillating on this thing. And I hear you, Dr. Johnson and Suzanne. This was a good thing. It was an opportunity. But Dr. Deborah, you talked about this continuum of thinking about getting the vaccine. What's your thought now that we have two right now really close colleagues who said, I came out okay?
Well, it's a couple things. So the first thing is I was very apprehensive at first. And so I fully can understand people's apprehension because I'm like, I haven't seen any data. I haven't, gotten the sort of reports that I need that would make me, as somebody who I think is more knowledgeable about this stuff than maybe your average citizen. And the things that I was reading, I thought, well, this doesn't give me what I need, and it's not clear. And I was left with more questions than answers. And so my brother says, drink the same Kool-Aid you're serving. So I've been doing what I've been telling others to do, which is to do my best to get information and get understanding. And we've got great colleagues. We've got the National Medical Association, which is the organization that represents the collective voice of Black physicians across the country. They are a part of the Congressional Task Force. They've looked at the data. They've asked questions specifically about things that might have a particularly unique impact on African Americans, like adverse reactions for people who have sickle cell trait and things like that. So as fast as we are generating the questions, we actually have good people who are doing the work to get us those answers. And the other thing that I accept is that, there's a lot of people who are doing everything they can to cut the line. Mm-hmm. And, my apprehension as an African American, it grew up in a healthcare system and in a society where I did not see fair play. It's hard to be African American in this society and not have experiences directly of racism or discrimination that are based on race, and some of the other things. So to me, the mistrust is valid, and I balance that against, now I've gotten my questions answered. I've gotten the information. I've talked to people also who've been vaccinated. I've talked to physicians, because the healthcare folks are the frontline people. They're the ones who are getting it first. And I tip my hat to you all. Because, definitely I said, well, I will likely get it, but I will not be the first in line. Mm-hmm. I didn't even have the choice. It wasn't even an option because I'm not a frontline healthcare worker. So I am really grateful. And I will be getting the vaccine when it becomes available. And I will let people know also, I am fighting tooth and nail that developing nations be first in line for the single dose vaccine. That just seems like fair to me and global equity, because it doesn't have the same cold chain problems and storage problems and gotta come back problems. You talk about transportation barriers, that pales into comparison to what people face with transportation barriers getting to healthcare appointments in some developing parts of the world. So I've gotten all my questions answered, and so I'm ready, and I feel empowered with my choice because I made the choice before the choice was imposed on me.
So thank you, Dr. Deborah, and it is memorialized now. We have heard you say it right here on.
I'm getting the vaccine when it becomes available, and my turn in line comes up. I will I will be getting the vaccine. Not only that, my family will. Because I've also been telling people it is ultimately an individual decision. And when I say my family, I have 3 young adult children. Shout out to my youngest baby girl, Olivia Joy. Her birthday is today. She was actually born at 1:44 for about an hour away from her actual birth anniversary. But in my house, the day starts, I went and climbed into bed with her and we retell her birth story, which was actually a really fun one. But happy birthday to Olivia. But it's an individual choice, but I do believe it should be a family conversation.
Yeah.
And the reason that I say that is because I think people will get the false impression that if they get vaccinated, that all is well.
Wow.
Right. And maybe
I think that's really important.
I'm sorry, Dr. Johnson, would you?
I think that piece that Dr. Verholden mentioned is really important. There's a piece of the data that we aren't really clear on, and that's the ability to spread the virus once you've been vaccinated, which means we might be protected. The people who get vaccinated are protected, but that doesn't mean that they might not be able to spread the virus and give it to other people. And so this idea about having conversations in your house about what the vaccine, whether people want the vaccine or not, and being thoughtful about choices around the vaccine is really important. I also want to highlight this idea that the majority of the physicians that I talked to early on, let's say November, when the idea or the thought that we would be getting the vaccine pretty soon came up, the majority of us were hesitant. The majority of us we want to see the data. We need to see what the data says. And as more data came out and as we kind of got more information and were able to make that sort of informed decision that Dr. Verholden mentioned, many of us felt better about the decision. And I really like that phraseology of saying, I was able to make a decision before that decision was made for me. And I think a lot of us feel comfortable in the idea that we were able to look at the data and make an informed decision based on what we know.
Yeah. And so for those of us, yes, Suzanne, I hear you. I just want to repeat that those of you that are listening, the major reason that we are here doing these webinars for these 42 weeks now is so that you are able to make an informed decision. We can only give you the information, but then it's up to you to really process, dissect it, and come to a decision that is best for you and your family. So Suzanne, you had something else you wanted to share.
Yeah, so I want to remind everyone, yes, it's a personal decision and that data is so important. But the recognition that the Swiss cheese analogy that Dr. Reynolds brought up is still so critically important, even after you've gotten vaccinated. There's so many things about this virus that we don't know. And we don't know, again, whether or not being immunized protects other people. And that's the key thing here, to recognize that the Swiss cheese analogy is not going to go away anytime soon. And it's so important that we continue to practice all those preventive measures, even after Dr. Edwards Johnson and I have had our first dose of vaccine. Don't lose sight of that. It's really important.
Thank you, Suzanne. Dr. Reynolds, I saw you getting excited because you got a conversion.
Well, there's 2 points. Number one, I'm looking forward to the new administration in the White House because they will rejoin the World Health Organization. And I think that's the United States stepping up to its responsibility. So I'm really looking forward to that development. Number two, in regard to the vaccine, it's just like the coronavirus. Keep in mind, we do not know everything. We know enough to say that this is an acceptable risk for protection when we practice the other 9 layers of protection, but we don't know how long that protection lasts. And you can say, oh, well, then it's not worth doing. Well, we get a flu shot every year because the flu vaccine changes, or we don't know how long the antibody levels will remain protective, the neutralizing antibodies. So it's important that if you hear something today from credible sources like the CDC and our state and county health departments, that message based on data and experience may change 3 to 6 months from now. But keep in mind, what is your purpose? And that is to protect yourself and to protect your family. Then let's talk about the role of people of color, low income folks, people who have not been paid attention to over the decades for various issues. If we don't get immunized, we will never reach that goal for herd immunity like we have for measles, mumps, and rubella. And even that's tenuous because not everybody is getting that immunization now. But it's important to maintain a vaccine level high enough so that we will maximize that protection.
Yeah.
And we still may have to do all those other things that we've talked about, but it is a step forward. And I said last week, I got a 92-year-old mother. She is going to get it, and she's a retired RN from Lincoln School of Nursing, the Black nursing school in the Bronx, New York. She's going to get the immunization as soon as it's available. Uh, I will get it as soon as it's available. I'm so proud of the dean of Meharry Medical School who stepped up and was part of the clinical trials and others. So, we have a responsibility, and you can say, oh, well, they're just experimenting on us. But, this is an equal opportunity project. And sometimes we have to step up to protect the people that we love and our community, and sometimes the people we don't feel so good about.
Yeah.
But that's our responsibility. And yes,
Yvonne?
there have been problems in the past,
Thank
but
you.
we must step up.
Yeah, thank you, Dr. Reynolds. I want to acknowledge that we do have people that are listening and looking and paying attention. And one of the things that came up is about mandatory vaccinations. Do you think vaccinations will be mandatory? And I want us to address that. And when doing that, I also want to say a number of people have been paying attention to our conversations, and you mentioned credible voices. And part of it is I may hear Dr. Fauci, and I may see Francis College from the NIH, but they're on TV to me. I'm touching and I'm in the community with you all. So you become more of a credible voice to me. So I'm happy to hear and know that there's still investigation that you're doing behind the scenes so you can speak to these issues on this screen for us as community. And I know we don't have all the answers. So I want to just first of all address this. Do you think that at some point, and this is like the weatherman analogy right now, for sure, but do you think at some point or eventually vaccinations for COVID will be mandatory if they become available?
This is Suzanne. I just want to say that I believe because this is an emergency use authorization for vaccine against a virus that has pretty much had a terrible toll on our community, it is not going to be mandatory. This is an emergency use authorization. Dr. Reynolds talks regularly about risk, and I think that's an important thing for us to talk about as well. When I made the decision to get vaccinated, I looked at the data just as Deborah Holden has talked about. I also recognize that my risk with my health issues and with as much as I'm out in the community and the work that I do, that I was in a better position accepting the vaccine than not. I think those are conversations that we all are going to have to have. But again, this is an emergency use authorization of a vaccine in a pandemic. And again, it's about the risk.
Okay,
I,
so
I want to say something though, because I have a slightly different point of view about it, which is that the EEOC, as an example, which is the organization that would normally make sure that there was, fair play, no discrimination in the workplace, et cetera. A lot of healthcare facilities have started to say to people, if you want to work in this ward, or if you want to work in this facility, or if you want to be able to be around these types of patients, you must get vaccinated when the vaccine is available. And if you don't, it will bar you from being able to work with these patients or in this ward or in this facility. And the EEOC would be the organization that would normally say, you can't do that, right? But the EEOC has gone on the record and said, hey, that we don't see this as in our wheelhouse. So the question of will it be mandatory? I think perhaps the exact virus we have now that's under this emergency use authorization, all that, I think everything that Suzanne said is valid, but I think the writing may be on the wall that if people aren't making the choice and thinking it through for themselves now, it is possible that at some point in the future, depending on where you work, your risk level, the risk level of the people that you interact with, you know, especially if you're in a nursing home or in a hospital setting, you know, I'm torn about would I want my loved one in a nursing home where 70, 80% of the staff opted to not take the vaccine, but they then pass it on to my loved one. These people in these nursing homes oftentimes are not even leaving the nursing homes. We're talking about people who had never left their room during COVID, and then they left in a body bag because somebody else's behavior or exposure or negligence, you know, put them at risk. So I don't know. I don't think we can say with absolute certainty whether or not these COVID vaccines might not at some point be mandatory, which is why I encourage people to do the work now and think about it. There's something to me really powerful about choice. To a fly on the wall, it might look like the same outcome. It might look like Deborah getting a vaccine, but the process of how I got there was empowering for me because I was honest about where I was, got my questions answered, and I've moved on the continuum. I went from a hex no to okay, I'm getting it.
Yeah.
We call that vaccine
hesitancy.
And now that I'm looking for, and I'll say this unabashedly, I'm looking forward to getting straight, consistent information from our governmental agencies now that we're going through a change in administration. And then I'll speak from a generational issue. And that is, I'm one of those old folks with that scar on my shoulder for smallpox. Okay, that was mandatory for me to go to school in New York City. I will say that when I was president of a children's health center, it was mandatory that our staff had their immunizations up to date and they got the annual influenza shot unless they had a medical reason if they wanted to continue to work in our organization. And so if they had a medical reason, they were required to wear a mask and not come in like all of us if we're sick. So I understand that concern about coercion and being forced, but the other part is if as a health professional or whatever your trade, your job, your title is, if you step into a role that will put others at risk due to exposure to you, I would say I would err on the side of saying, in order to work in this setting, providing this service, you need to be vaccinated. Now, I'm not the court. I don't have the power to order anybody, but I hope that people will process. This is not just about me. This is not just about my household. This is about our community. And so we need to, while we're waiting, because we're not going to get the vaccine to everybody next week. You got plenty of time to work through this. You have plenty of time to get the things that you can get, like your influenza vaccine. Yes, I'm a broken record, but you have time to make these decisions and don't put it off. You know, you ask questions, you gather information, and things may change. But at some point, we have to consider what is our responsibility to our community. And, you know, we're in Kwanzaa, and one of the things we talk about is purpose, collective work and responsibility, and unity. Are we going to reflect our culture? Or are we going to act like these folks running around talking about, well, I want to exercise my freedoms? Don't make me say a bad word right now.
Yeah. Don't say that.
But, you know, it's your freedom comes with responsibility. And as Cornell West would say, politics is an outside expression of love. Or was it Michael Eric Dyson? But nonetheless, what we do to prevent the spread of disease is a outward reflection of our love for ourselves and for our community. And you don't know how wide your community is. So, like the Bible says, love your neighbor as you love yourself. Just some things to consider as you make these decisions.
That's the chief health advisor for the city of Flint. He's advising us today. In full transparency, one of the things that we really want to do is make this real plain and clear to people who are not sitting at some of the tables that you all have the opportunity to sit at, who have not had the academic training, who do not really understand all of what I call the alphabet soup sometimes. So I want to just tease out a couple of things. Dr. Deborah, you mentioned EEOC. And there was also mentioned by Suzanne, the Emergency Use Authorization. Can we explain what these things are so our listeners really get? There is a body of individuals that are responsible for looking out. And Dr. Deborah, you're at the forefront of the health equity solution. So you always talk about these equity issues. So help us. EEOC, What is that all about?
Equal Employment Opportunity Commission. It's their job to ensure that there's fair play in the workplace and that people aren't being discriminated against based on things like race or gender or religion or disability status or things like that. They would be the federal sort of organization that would come in and make sure that people's rights aren't being violated with respect to getting into the workplace or once you're in the workplace.
So you said cutting the line, and you said cut the line. Does that mean get in front of folks? What are you talking about?
I mean, if we're just being honest, it's a whole lot of billionaires and millionaires who are making calls and phoning their friends trying to get to the front of the line to get the vaccine, because there is a line. We have a supply and demand problem. If every human being that wanted or said, yes, when the vaccine is available, I will get it, up to and including right now. If all of those people step forward right now, we don't even have a fraction of what we would need to vaccinate all of those people. That's why
it's give the second dose.
Yeah, and get
the second dose.
Being rolled out in phases. And there's a whole lot of debate. I don't think that's a great debate for us to have, but a lot of debate about whether or not people should be focusing on getting everybody the first dose, knowing that the second dose is coming. Because I guess in a few places they've had some vaccine that's spoiled or, whatever happened. I think it would be disastrous for people to get that first dose and not be able to get the second dose. So to do it responsibly, when you hear 1 million doses came to such and such a county, you got to cut that number in half when you think about how many people that will serve, because people will have to get the 2 doses. So it just boosts confidence is what I'm saying, because, if wealthy white folks want to get it, that sort of undermines the conspiracy theory for me. And not only do they want to get it, they're rushing to the front of the line, stepping over people, pushing past people to get to the.
You could have seen on my Twitter, where I follow a lot of colleagues, there was this fear of missing out. There was this idea that people were posting their vaccine, them getting vaccinated in pictures. And there were people like, oh, I can't wait to get mine. My date, they haven't sent me my email to say when I'm going to get it yet. There is very much this sense of, I need to use all the resources I have to be able to get vaccinated as soon as I can. And I think that speaks to what Dr. Verholden is mentioning in terms of cutting the line. People are thinking about their resources and people are thinking about their affiliations and thinking about how they might be able to fall into one of those categories, or more nefariously, just cut the line and get the vaccine. And that's a real thing. It's something I've seen.
So it is important to have voices at the table such as yours to make sure that these considerations are given to people who may not be at the table. Now, Suzanne, you mentioned this emergency use authorization, and I heard something a little bit concerning to me about this emergency use authorization. So can you explain to us how this works? Because it's there's some things that we don't understand about that.
So again, I want to again talk about the website www.gchd.us. You go to the COVID-19 section, click on the button that says vaccine information. There's a lot more information about the process that vaccines and other drugs go through with the Federal Drug Administration in order to get approval. We recognize that COVID-19 is a pandemic that's taking a significant toll on our community. And the authorization to utilize the two vaccines that have been approved, Pfizer and Moderna, goes through a very rigorous process for evaluation. And the FDA has given an emergency use authorization. Again, recognizing this is a novel virus, there are a lot of things we don't know. As Dr. Reynolds said, we don't know how long it's going to provide protection. We don't know if, as Dr. Edwards Johnson said, if it protects us from providing, exposing people to COVID-19 in our community. So there are still things that we don't know about this vaccine and how effective it's going to be, or for how long it's going to be effective. So when I say I don't think that they'll make it mandatory, I think I want to say that when it's still under the emergency use authorization, because there are so many things about COVID-19 that we don't know or understand as of yet. I want to also remind you that on our website, it does share information about the priority guidance. And so if you look at it's the first item when you click on that vaccine button to talk about the guidance on who gets vaccinated in what order. And as Dr. Verholden said, there's a lot of conversation about that order, and that comes from the CDC and others. But the recognition is that uh, the idea is that they're trying to protect those that are most at risk, and that's why they are first in line to get vaccine. That's a challenge for having that conversation. Dr. Verholden talked about vaccination. I will say that we're being encouraged to get vaccine out with the understanding that that second dose of vaccine will be available to us at that later date. So we'll be immunizing people and getting people taken care of, recognizing that that second dose is going to be coming. As a public health person, it's challenging because we don't know how much vaccine we're going to get and when we're going to get it. That's a significant challenge when you're trying to plan for how to get it out in the community and how to get it to those most vulnerable populations. Dr. Reynolds has talked about a new administration coming into power in January. My hope is that there will be a lot more effort put into this whole distribution process, getting the vaccine to us in a more timely fashion, with more advanced communication about how much and when we're going to get it. That makes it a lot easier to plan to get it to the people who are most at risk in our community.
So I get really challenged when I hear that risk in most homes, because when I put myself on this continuum, I fall into that bucket a whole lot of times, and nobody has said to me, Yvonne, get in line. So we know that things are changing like almost every minute. We're sharing information today, and tomorrow we could learn something very differently. So, Dr. Reynolds, in your experience as a pediatrician working for a health center and now being the chief health advisor for the city of Flint, how do you help the residents who are not in the let's say the highest level? And I keep hearing what you say, Dr. Deborah, and even for what you said, Dr. Johnson, there are some people who may not fall into any of those categories, but may have the means, the resources to get in line. What do you say to us, Dr. Reynolds, as everyday people? Let's talk about everyday people.
Let's talk about being in line. Based on my age and my health risk factors, there was some website that gave a predictor of where you would probably get your immunization, what your place in line is. And in Genesee County, with 405,000 people, I can get in line when they announce it, after 26,600 people have already been vaccinated. Okay, so I'm not jumping the line. And then I'm gonna throw a firebomb in there because there's things that we don't consider. Okay, when we have a Black population in Genesee County that's about 18%, but we are 33% of the deaths. Is that the latest report, or 38%? There
2 to 1.
is, yes, that indicates that there is a disparity. And that means that there's a group of people who are socially vulnerable and who need to be moved up ahead on the line. Now, someone's going to say, well, are you proposing that only Black folks get immunized? No, because this is America, and imagine the backlash. But let's talk about social vulnerability. Folks who have been discriminated against by race, if you accept that construct, ethnicity, language, disability, income, their living situation. So let's look at the big picture. We're talking about social vulnerability. And then here's the other challenge. We have men and women in detention, jails, and prisons. And those are hot spots. And if we're looking at most socially vulnerable, perhaps we should be more attentive to that population. And it's not just because of the prisoners, because it's just like in the hospitals. The corrections officers get infected, the support staff gets infected. And guess where too many prisoners come from? Our communities of color, low income communities. And then guess where they return if they're released. So sometimes we can't be so selfish as to insist, oh no, they're prisoners, they don't deserve it. No, you see, this is where that whole concept of uh, purpose, collective work, and responsibility and love for our neighbors come in, because we don't know what family those folks come from. We don't know where they're returning. And that goes for the prisoners as well as the guards and the support staff.
And the homeless shelters, recognizing that there are folks who are incredibly vulnerable in our community. And those are what we call congregate settings. There are a lot of people in the same location that are easily able to spread COVID-19 to others. And again, there's just a lot of work that goes into all of this. And the recognition is that we can't tell you when we're going to get vaccine and how much we're going to get. So there's a lot of hard work that's going to happen this year in getting this sorted out. And my hope, again, in this new year, 2021, is that many of those challenges that we faced in 2020 will be addressed appropriately in 2021, so that I could definitively say, Dr. Reynolds, I know when you're going to get your dose of vaccine. I know when you're going to come up in the queue, and I can say to you, come on down, let's get you immunized.
I like that. Come on down.
I'm
Well,
ready.
let's talk about this for a quick minute. We spent most of the day talking about vaccines. And we also have just acknowledged everybody's not going to get in line right away. Everybody's not going to get vaccinated right away. And even when it becomes available, we still will, hopefully, we'll be kind and wait our turn. But in the meantime, Dr. Reynolds, you mentioned purpose, collective responsibility. And what can we do? Well, we know right now we can all get tested. So we want to just remind us about the opportunities here in Flint, Genesee County to get the COVID test. If at a minimum, you know what your status is. I was happy to be able to say, my daughter and I, we got tested, we were both negative, so we all felt pretty good about that. But we need to go do it again. And so just because even when you go to the store, you're out and about, you don't know who you might come in contact with. And what we're learning is more and more people are having difficulty identifying the point of origin for their exposure, which is a challenge for contact tracing. So here on our screen, and Suzanne, you do this so well for us on the webinar every week. Can you just go really quick, because we're getting close to time here. But here in Flint, Genesee County, a number of places for folks to get tested.
Right. And we're very fortunate that we have 3 community sites as well. But I want to remind everybody about the Swiss cheese model that Dr. Reynolds has talked about. Testing is an important part of that model. And even as we get vaccine into our community, we still need to work on testing and get everyone tested. So we have 3 community sites, Word of Life, Bethel United Methodist Church, and Macedonia. They're doing the oral swab, again, recognizing no food or drink for 30 minutes before you go to get tested. And they will take anyone who shows up, but it's preferable that you make an appointment. It makes things a lot quicker through the line. Although we know people don't have access to a computer, this is a pathway for you to get tested. We also have Walgreens in Flint, Hamilton Community Health Network at their North Point Clinic at Burton Fire Station. That's at the corner of Bristol and South Saginaw, and the Rite Aid in Swartz Creek, and the Rite Aid in Flint. And also wanted to give a shout out to Genesee Health Systems. They've been great about making sure they do mobile testing in our community. Again, addressing the needs of our homeless shelters, the group homes that cannot have their people come to a testing location.
Thank you, Suzanne. So what we want to ask those of you that are listening to us, and we appreciate you for tuning in today, please share this information. You can like us on Facebook, or please share this information. We want to let you know, you went too fast for me, Dr. Deborah. ML King Day is coming up in January, on the 18th. We're already in January. So on that day, testing sites will be closed. So if you're interested in getting a test, please do so previously or right after that day. But on that day, the testing sites will be closed. As Suzanne mentioned, they do request that you make an appointment, but if you do not have that opportunity and you need to get tested, please go to one of these sites. We're just so thankful that you have tuned in today. And I just saw in our, some of you just may have happened up on this Healthy Flint Research Coordinating Center event today. But we're going to be back here next Friday. We'll be back on schedule next Friday, January 8th. We have a great session lined up for you. You don't want to miss it. It will be on our webinar. So you go on Healthy Flint or hfrcc.org. You can do that for us. If you are here and you want those continuing education units, please remember, particularly for our community health workers, continuing education units are available for you. All you have to do is follow the directions and you can get access to those continuing education units. As I mentioned before, we will be back next week. You can go on our website, like us at hfrcc.org, go on our website, like our YouTube, not like us, but like our Facebook channel, and then join us, subscribe to our YouTube channel. Dr. Deborah's trying to help me get all of these things together. That's my senior thing kicking in, Dr. Reynolds. But like us on Facebook, subscribe to our YouTube channel, and then always feel free to email us. And of course, you can give us a call at 810-835-2130, and we'll be happy to have you answer the questions that you put in. I want to appreciate everybody that's put in comments for us today. This helps us to have a great opportunity for us to communicate. As I mentioned, the Flint Community Webinar on Coronavirus, we will be back here next Friday, back on our regular schedule, Friday from 12 to 1. Before we check out today, I want to just get, what's the last word? I'm going to start with you. You got about 20 seconds. What's the last word, Suzanne?
Hope that 2021 will be much better than 2020. We know that we have vaccine available. Everyone's got to do their research, make the decision for themselves, and recognize we have 2 vaccines that have emergency use authorization now, but there are likely to be many more in the next few months. So there's a lot to sift through, to read about, and to understand before you make your choice.
Thank you. Dr. Johnson.
I like hope. I don't know. I'm going to go with gratitude. I'm thankful for platforms like this. I think it's really important for us as medical personnel and people kind of the who know a lot about this to understand that there are a lot of reasons that people might have distrust or may not have access to resources to understand what's going on with COVID, and have a history of, we have a pretty significant history of distrust within our communities and disparities within our communities. So I think platforms like this are essential to make sure we have an opportunity to talk about the facts, to look at each other and have people who look like us disseminating information that's important.
Thank you. Dr. Reynolds.
I would say opportunity. We have the opportunity to do better. I just heard Dr. Benjamin Georges, or Dr. Georges Benjamin, who was head of the American Public Health Association, say, look, if we live in an economy where we can get food delivered 24/7, why don't we have an opportunity to test and immunize 24/7 with the same kind of efficiency? And that, for me, was a slap in the face. We have the opportunity to do better, and I'm looking forward to that.
And Dr. Deb, you get the last word. You're on mute.
It's because I switched mics. Sorry about that. Can you hear me?
Yes.
I just want to back my colleagues up. I agree with everything they said. I like all of it. I like the hope. I know we need to persevere. I know we need to have faith, and a lot is in our hands. So I'm just asking people to persevere and stay the course. This is not a done deal. The script is not written. We're writing the script in real time. So what we do will determine how this goes. And so I just encourage everybody, keep doing the work, have those family conversations about the vaccines, do your part to stay safe. If you have been exposed, get tested. We had a question about, should you get tested if you don't have symptoms? And what I always tell people is, we'll never slow the spread if we only test symptomatic cases. When we didn't have sufficient testing, we did what we had to do. We had to ration them somewhat. We're not in that space anymore. We need to be testing people who are out and about and moving around, people who have hosted large gatherings, or anybody that has any whiff that they may have had a known exposure. Those people need to be tested. If we can do those things and honor the protocols, we can be out of this thing and have a very different 2021 than we did in 2020.
Thank you. And we're depending on you and listening to help us make this all a reality for our community. See you next Friday, 12 to 1, Health and Research Coordinating Center's community webinar on coronavirus.